Hello, everyone. I've seen countless cases of heart attacks in seniors, and I want to be extremely clear. If you are over 60, a heart attack can become fatal in minutes, especially if you are alone. This is not fear-mongering. This is real, life-saving knowledge. Studies show that almost half of all heart attack deaths occur before a patient ever reaches the hospital. Think about that for a moment. Nearly 50% of seniors experiencing a heart attack may never make it to emergency care. And the reason is almost always the same: hesitation, panic, or simply not knowing what to do. I cannot stress this enough. Every second counts. Every minute wasted, every second spent doubting if it's just indigestion or maybe it will pass, can literally mean the difference between life and death. I want you to imagine this scenario. A 68-year-old man in Ohio feels a sudden crushing pressure in his chest one evening. He tells himself, it's probably just gas, drinks some water, sits down, and waits. Hours pass. By the time his daughter finds him and calls 911, the damage is already done. Doctors tell the family that if he had called immediately, he might have survived with minimal heart damage. That story is repeated thousands of times every year, and it's entirely preventable. So, what can you do to double your chances of survival, even if you are completely alone? That's what this video is all about. Today, I'll walk you through 7 life-saving tips every senior must know. These are scientifically backed, practical strategies, not myths, gimmicks, or marketing tricks. These are the same techniques that cardiologists teach their patients and that I wish every single person entering my ER knew before it was too late. By the end of this video, you'll know exactly what steps to take if a heart attack strikes when nobody is around. And trust me, tip number 3 alone can save your life and prevent permanent heart damage. Before we dive in, let me ask, how old are you? Drop your age in the comments. I personally go through every comment and reply, like it's a conversation in my clinic. All right, let's get started. Tip number 7, call emergency services immediately. This may seem obvious, but it's the single most important step you can take when a heart attack strikes. When you feel chest pressure, sudden shortness of breath, dizziness, nausea, or cold sweat, don't wait. Don't doubt yourself. Call emergency services immediately. Why this is critical? Time is muscle. Cardiologists often say, time is muscle. Every minute that blood flow is blocked, heart muscle cells die. And once they die, they cannot be regenerated. Research shows that patients who call 911 within the first 5 to 10 minutes of symptoms have survival odds up to 50% higher than those who wait. Yet studies also show that nearly 1/3 of seniors over 60 wait more than 2 hours before seeking help. Why? They don't want to bother anyone. They underestimate the danger, or they hope the pain will go away. This hesitation is tragically common, and it costs lives every day. Real-life example. Let me give you an example. A 72-year-old grandmother in Florida felt chest tightness and dizziness while gardening. Instead of waiting or trying to walk it off, she immediately dialed 911. Paramedics arrived within minutes and provided life-saving care on the spot. She survived with only minor heart damage, thanks to one simple action: calling emergency services right away. Contrast that with someone who hesitates. Every minute wasted is precious. The longer you wait, the higher your risk of irreversible heart damage or death. Tips for making the call efficient. Keep your phone nearby at all times. If you live alone, place it within arm's reach, ideally on speaker mode. Know your address and any important medical info. This includes medications, allergies, and medical history. Paramedics will ask for this immediately. Speak clearly and calmly. Even if you feel dizzy, do your best to communicate symptoms. Follow instructions. Emergency dispatchers will often guide you through life-saving steps while help is on the way. The takeaway: calling emergency services immediately is the step that literally buys your life. Even if it turns out not to be a heart attack, you've lost nothing. But if it is a heart attack, this is your first line of defense. Once you've called emergency services, the very next step can make a dramatic difference between survival and permanent heart damage. That step is taking an aspirin, but not just swallowing it. Chew it. Why chewing matters. Many seniors think aspirin is just a painkiller. In reality, during a heart attack, aspirin is one of the most powerful clot-fighting medications available without a prescription. Here's how it works. A heart attack occurs when a blood clot blocks an artery supplying the heart. Aspirin works by thinning the blood and preventing the clot from growing, which keeps some blood flow going to your heart muscle until professional help arrives. And here's the critical point. How you take it affects how fast it works. Swallowing a whole aspirin tablet means it can take 10 to 12 minutes to dissolve in the stomach before entering the bloodstream. Chewing it breaks it into small pieces, allowing faster absorption through the mouth and stomach lining, sometimes within minutes. In a situation where every second counts, those minutes can save heart tissue and potentially your life. Scientific evidence. Research backs this up. A landmark study in The Lancet showed that taking aspirin during a heart attack reduced mortality by 23%. Another review published by the American Heart Association confirmed that immediate aspirin intake can significantly reduce heart muscle damage, especially in seniors over 60. Real-life example. Consider Mr. James, a 70-year-old retired bus driver living alone. One afternoon, he felt a sudden crushing chest pressure and shortness of breath while watching TV. He remembered advice from his cardiologist. Chew aspirin immediately. He grabbed the bottle, chewed a tablet while calling 911, and sat upright. Paramedics later told him that action kept blood flowing just enough to prevent major heart damage. 2 weeks later, he walked out of the hospital alive, independent, and fully recovered. Dosage and safety tips. Recommended dose. Usually, a full 325 milligrams tablet is suggested at the onset of heart attack symptoms. Chew, don't swallow whole. Exceptions. Allergic to aspirin? Skip this step. Bleeding disorders or medications that prevent clotting. Consult your doctor about alternatives like clopidogrel. Keep aspirin accessible. Store a bottle in an easy-to-reach place. Your bedroom, living room, or kitchen. Seniors often hesitate because they don't have it on hand. Extra tips for seniors. Consider having extra bottles in multiple locations at home. Pair aspirin intake with sitting upright, tip 5, and deep breathing, tip 2, to maximize blood flow and oxygen delivery. If someone is hesitant due to fear of side effects, discuss with your doctor about low-dose aspirin daily as a preventive measure. Key takeaway. Taking chewed aspirin immediately during a heart attack is like sending in reinforcements to slow down the disaster until professional help arrives. It does not cure the attack, but prevents the situation from spiraling out of control. Combined with calling emergency services, this action can literally double your chances of survival. When a heart attack strikes, every little movement you make affects how much strain your heart has to endure. One of the simplest yet most overlooked survival actions is this. Loosen tight clothing and sit upright. Why posture matters? During a heart attack, your heart is struggling to pump blood through blocked or narrowed arteries. Tight clothing, belts, waistbands, bras, collars, or even tight shirts can compress blood vessels, making it harder for blood to circulate. Sitting upright relieves pressure on the diaphragm and lungs, making breathing easier. It reduces the workload on your heart, letting oxygen-rich blood reach vital organs more efficiently. Medical studies back this up. A clinical review in the European Heart Journal emphasized that positioning patients upright during cardiac distress reduces pulmonary congestion, which is the buildup of fluid in the lungs that makes breathing difficult. Essentially, your body is trying to breathe and pump blood simultaneously, and the right posture can buy you precious minutes until help arrives. Real-life example. Mrs. Linda, a 74-year-old retiree in Florida, experienced chest tightness and shortness of breath while gardening. Many seniors might instinctively lie down in panic, but she moved to a chair, loosened her gardening apron and waistband, and sat upright. By the time paramedics arrived, she had remained stable and conscious. Her doctor later explained that this simple adjustment likely prevented her from fainting or collapsing, giving her heart the chance to survive the attack with minimal damage. Step-by-step instructions for seniors. Move to a chair or support yourself upright. If you're on the floor, sit up slowly if you can. Loosen belts, ties, bras, or any tight clothing around the waist, chest, or neck. Relax your shoulders and neck. Tension can further restrict circulation. Keep your back supported if possible, with your head slightly elevated. These small adjustments may seem minor, but they significantly improve airflow, reduce stress on your heart, and allow better oxygen delivery. Additional tips: if lying flat, place a pillow under your back and shoulders to elevate your chest slightly. Avoid sudden movements. Every motion increases heart workload. Combine this tip with tip 6, chew aspirin, and tip 2, slow, deep breathing, to maximize your survival odds. Why seniors often overlook this? Many seniors underestimate the impact of restricted circulation. They think, I'm just resting, but tight clothing plus poor posture can accelerate oxygen deprivation to the heart and brain. Think of it this way. Your heart is a fragile engine running on low fuel. Sitting upright and loosening tight clothing reduces unnecessary strain and allows the engine to function longer until professional help arrives. Key takeaway: loosen tight clothing immediately at the first sign of heart attack symptoms. Sit upright with back support to improve breathing and circulation. Small adjustments like these can keep you conscious, stable, and buying time for emergency responders. This tip may sound unusual, almost counterintuitive, but has saved countless lives in emergencies. When a heart attack strikes, fainting is a real and dangerous risk. But a technique known as cough CPR can temporarily keep blood flowing to the brain, helping you stay conscious until help arrives. Why coughing helps? During a heart attack, your heart may struggle to pump blood effectively. This can cause a sudden drop in blood pressure, leading to dizziness, fainting, or loss of consciousness. Here's where coughing comes in. A strong, deep cough compresses the chest and forces blood out of the heart, momentarily maintaining circulation. It's similar to creating artificial heartbeats, buying precious seconds of oxygen delivery to your brain. Medical research confirms this. A study in the Journal of the American College of Cardiology found that repeated forceful coughing during cardiac arrhythmias helped patients stay conscious and maintain blood pressure temporarily until emergency care could take over. How to perform cough CPR. Take a deep breath before coughing. Cough hard and deeply, as if you're trying to clear your lungs. Repeat every 2 to 3 seconds, maintaining rhythm. Keep your head elevated and sit upright if possible. Tip 5. Important: cough CPR is not a cure for a heart attack, and it does not replace emergency care. But in those critical minutes before paramedics arrive, it can prevent collapse and brain damage. Real-life example. Mr. Robert, a 69-year-old retired mechanic in Texas, was alone in his workshop when he experienced severe chest pressure, dizziness, and lightheadedness. A massive heart attack. He remembered the advice he heard about cough CPR. He coughing strongly every 2 to 3 seconds, keeping himself conscious. By the time paramedics arrived, he was alert, breathing, and stable, even though his heart was compromised. Doctors later said those repeated coughs likely prevented him from collapsing and suffering brain damage, giving them time to restart his heart safely. Additional safety tips. Combine cough CPR with tip 6, chewed aspirin, and tip 5, sitting upright and loosening tight clothing to maximize survival. Avoid sudden movements during coughing. Stay as still as possible. If fainting symptoms intensify, continue coughing and call emergency services repeatedly if possible. Key takeaway: cough strongly every 2 to 3 seconds if you feel faint during a heart attack. This simple action can keep blood flowing to the brain, keeping you conscious until help arrives. Remember, it buys time, it does not cure, but it can be life-saving in those crucial minutes. When a heart attack strikes, every second counts, not just for your body, but for the people trying to save you. One of the most overlooked survival steps is incredibly simple. Unlock your door and keep your phone within arm's reach. Why this matters? Think up. Out it. Paramedics can break down doors if necessary, but every extra barrier costs precious minutes. During a heart attack, those minutes can mean the difference between life and death. Studies show that for every 10 minutes of delay in treatment, survival rates drop by nearly 10%. Imagine losing those life-saving minutes simply because help couldn't reach you quickly enough. Real-life example number 1. The danger of a locked door. A 73-year-old widower in Arizona experienced severe chest pain and called 911. Unfortunately, he had locked his front door. He collapsed before he could unlock it. Paramedics arrived minutes later, but had to force entry, delaying critical treatment. By the time they reached him, irreversible heart damage had occurred. Contrast this with a safer scenario. Real-life example number 2. Quick access saves lives. An 80-year-old woman in Florida, living alone, felt chest pressure and dizziness. She had unlocked her door in advance and kept her phone right next to her. She sat upright by the entryway and called 911 immediately. Paramedics arrived, started treatment immediately, and she survived with only minor heart damage. The difference? Unlocked door plus phone within reach equals saved minutes equals saved life. Step-by-step instructions. Unlock your front door, or at least leave it easily accessible. Keep your phone within arm's reach, especially if you live alone. Use speakerphone if possible, so you can follow instructions without holding the phone. Sit near your phone and door if you start feeling symptoms. Additional safety tips for seniors. Consider keyless entry systems that allow emergency responders quick access. Some seniors install a door lockbox for paramedics, which can be used in emergencies. Always inform a family member or neighbor about your plan, especially if you live alone. Why seniors often overlook this step. Many seniors leave their phone charging in another room or forget to unlock doors as a habit. During a heart attack, even a few steps can trigger collapse. Keeping your phone nearby and unlocking doors in advance is a small action with huge consequences. Key takeaway: unlocked door equals faster access for emergency responders. Phone within reach equals instant communication with 911 and guidance. Together, these actions remove barriers and buy precious minutes. When a heart attack strikes, panic is your worst enemy. Fear can hijack your body, releasing a flood of stress hormones like adrenaline, which makes your heart pump faster and raises blood pressure. For a heart already struggling, this extra strain can accelerate damage. One of the most powerful and simplest survival actions you can take is take slow, controlled, deep breaths. Why breathing matters. Oxygen delivery. During a heart attack, your heart and brain are starved for oxygen. Slow, deep breaths increase oxygen flow to your blood and vital organs. Stress reduction. Deep breathing signals the nervous system to calm down, reducing the surge of stress hormones that make your heart work harder. Heart rate control. Studies show that controlled diaphragmatic breathing can lower heart rate and stabilize blood pressure, even in patients with advanced cardiovascular disease. Scientific backing. Research published in the Journal of Cardiopulmonary Rehabilitation and Prevention confirms that slow, deep breaths during cardiac distress reduce heart rate, improve oxygen delivery to the brain, lower overall stress on the heart. In other words, your breathing can literally buy you more time while waiting for emergency responders. Real-life example. Mrs. Ellen, a 76-year-old retired nurse from Michigan, experienced a sudden crushing chest pressure and shortness of breath while alone at home. Instead of panicking, she focused solely on her breathing. She placed a hand on her stomach, inhaling deeply through her nose and exhaling slowly through pursed lips. By the time paramedics arrived, she was weak but fully conscious. Her cardiologist later noted that those few minutes of controlled breathing likely reduced the workload on her heart and kept oxygen flowing to her brain, buying her critical time for treatment. Step-by-step breathing technique. Hand placement. Place one hand on your stomach, not chest. Inhale slowly. Breathe in deeply through your nose, feeling your belly rise. Exhale slowly. Exhale gently through pursed lips, like blowing through a straw. Pace. Aim for 6 to 8 slow breaths per minute. Focus. Concentrate on each breath to maintain calmness and prevent panic. Tip. Combine this with sitting upright. Tip 5. And remaining as still as possible. Tip 1. to maximize oxygen delivery and reduce heart strain. Additional advice for seniors. If possible, practice slow, deep breathing daily to make it instinctive during an emergency. Pair breathing exercises with other survival strategies like chewing aspirin, loosening clothing, or cough CPR. Stay mindful of your body. Panic can worsen symptoms, but controlled breathing helps maintain composure. Key takeaway: slow, deep breaths equals more oxygen to the heart and brain. Reduces panic and adrenaline spikes that strain the heart. This simple, repeatable action can make the difference between collapsing and staying conscious until help arrives. When a heart attack strikes, your first instinct may be to move, pace, or even try to walk it off. But that instinct can be deadly. The number one survival rule is simple but powerful. Stay as calm and still as possible. Every unnecessary movement forces your weakened heart to pump harder, increasing damage during a heart attack. Why stillness is critical. Conserves oxygen. During a heart attack, blood flow through the coronary arteries is blocked or severely reduced. Movement demands more oxygen from your heart muscle. If oxygen is already limited, extra exertion accelerates heart damage. Reduces strain on the heart. Each sudden motion forces the heart to work harder under stress. Staying still reduces the heart's workload, allowing oxygen to reach the brain and vital organs more efficiently. Prevents panic-driven decisions. Moving around in fear can lead to rash decisions, like trying to reach the phone across the room or climbing stairs, which increases the risk of collapse. Scientific backing. A clinical study published in the European Heart Journal found that minimizing exertion during acute coronary episodes reduced complications and improved survival outcomes. Seniors who stayed calm and still during attacks lived longer and with less heart damage than those who moved around in panic. Real-life example. Mr. Harold, a 71-year-old farmer from Nebraska, felt crushing chest pressure while repairing farm equipment. His first thought was to climb a ladder to grab his phone, but he resisted the urge. He stayed put, called 911 from where he was, and remained calm and seated. Paramedics later told him that his stillness prevented his heart from collapsing under stress, and he survived with far less damage than expected. How to stay calm and still. Sit or recline in a comfortable position, preferably upright. Tip 5. Take slow, deep breaths. Tip 2. To control heart rate and oxygen delivery. Avoid sudden movements or physical exertion. Every motion increases strain. Focus on your survival plan. Phone nearby. Tip 3. Aspirin if safe. Tip 6. Cough if faint. Tip 4. Mentally reassure yourself. Say, I have called for help. My only job now is to stay still and breathe. Additional advice. Pair stillness with other survival steps for maximum effectiveness. Train your mind ahead of time to respond without panic. Practice slow breathing and remaining seated during mild chest discomfort. Remember, your mental state affects your heart physically. Calmness literally saves heart muscle. Key takeaway: stillness equals life-saving strategy. Reduces strain, conserves oxygen, and prevents panic-driven mistakes. Combined with all the other tips, staying calm and still doubles your odds of survival in a heart attack when alone.